So, make we connect.
It's good. Hi, Deji. How are you?
Hey, hi, good, good. And you? How are you doing?
Hi. Pardon?
Yeah, I said, how are you doing?
I'm very well, thank you. Thank you so much. It's been a little bit funny. The connection was very erratic. It's very windy here in the UK. We've got I'm not sure what kind of wind this is. It's probably got a name. But this has affected my logging in. He said my connection was not very strong. So I'm hoping it doesn't interrupt tonight's um, interview. But we'll see how it
Yeah, no
goes.
worries. We can always log in, log out, log in again, if
Okay.
we have to. Yeah.
Okay, that's fine. That's cool. Okay, so very quickly again, let me just start all over again. Apologies, everyone. I don't know if anyone was watching, but hey, I've got Dr. Deji Daramola. He's a medical practitioner, a family physician, and a medical consultant, and he has obviously lots of years' experience behind him. And in view of what is happening today in the world, i.e., COVID-19, coronavirus, I've decided to bring somebody in the medical field live because I expect people would have a lot of questions, worries, fears, conspiracies flying left, fronts, everywhere. So everything is just up in the air. So I've decided to bring Deji in today to ask questions. So Deji, you're based in Canada, Alberta, and you run your own private clinic, medical center, and also you have another daytime job as well. So obviously you're seeing lots of patients all the time. Hello, Papi. Thanks for joining in. Nice to have you on here. Somebody's just joining. Papi J55. Hello. So tell me, and I'm not sure if you've been following the news, a lot of Black African nurses, frontline staff have been dying in huge numbers. And I'm very concerned, and I'm sure many people are concerned as well. There's been so many conspiracies that, okay, Black people are probably dying more in large numbers because we are at the forefront of this, i.e. nurses, support workers, carers, or possibly because they say, oh, we're deficient in vitamin D. I've read that somewhere. And sometimes I've read the fact that Black people, because of the way we think, our mentality, we think, oh, we're untouchable. Black don't crack. You know, we've drank dirty water in the past. We have a lot of infections in Africa as a continent, and we're still thriving, on top of it. So from your medical perspective, what would you, advise could be the possible or likely reasons why there's a high death toll amongst the Black ethnic minority? I'm just going to drop it like that.
Okay, thanks, Ada. It's kind of everything that you've said.
Happy.
It's everything you've said. I don't believe there's one single or singular factor for, the increase in mortality rates among people of color when it comes to, deaths from COVID-19. So I think that in the western part of the world, there is the fact that yes, there are studies that have shown that the fact that we're dark skinned, we might not have enough vitamin D. So our skin is basically built to shield off sun rays, because where we come from, there's a lot of sun in Africa, and the African sun is very unforgiving. So we evolved, or we are dark skinned to protect us from the dangers of the sun rays. Now, when we immigrate, like you and I have done, we come to a part of the world where, they don't have a lot of sun, and they've evolved to be, very fair complexioned, so that their skin can absorb the little sun rays that is available. Now, when we move from Africa to Europe or North America, we still bring along with us the dark skin. So the little sunlight that is available, our skin isn't letting it in like, it would. And you need
Okay.
sunlight to make vitamin D available. So that has been one factor, and there are studies that have, proven that. But I don't think that's the only case. So by the way, if you are an immigrant and you are living in the part of the world, the Western Hemisphere or Western part of the world rather, you need to take vitamin D supplements if you're not doing that. Um, so that's one case. The other thing that you mentioned, which I totally agree with, is that
Mm.
there's a lot of disinformation among the Black
Yes.
community generally.
Okay.
Um, I I believe that it is not what we don't know per se that hurts us the most. It is what we know for a fact, but that is wrong,
Mm-hmm.
that hurts us the most. So a lot of us believe that somehow, Black don't crack. We are invincible. We are, also we have taken lemon and ginger and herbal
That's it.
mixtures, and so
Thank you
therefore,
for
we're
mentioning
kind of
that.
we're kind of
Thank you for
invincible,
mentioning lemon. Sorry, thank
and
you for mentioning lemon and ginger, because that lemon and ginger business, Dr. Daramola, has. Do you know what? Thank you for bringing up lemon and ginger. We're going to talk more about that. Please carry on.
yeah, yeah. So that has added to our feeling of invincibility. Also, I saw on Facebook today some spiritual lists. I don't want to call them pastors,
Wow.
advertising
Wow.
anointing oil that will protect against COVID-19. Um,
Mm-hmm.
so this kind of practices, when you purchase $100 bottle of anointing oil that you think it's going to protect you from COVID-19, and you really believe that stuff, then there is the possibility that you're going to go outside and throw,
Mm-hmm.
caution to the wind, right? Um, then you have other things going around saying that COVID-19 is not really a virus, it's a bacteria. There's a lot of misinformation going out there. And I believe that we, as full of color, are more likely to buy into those kind of misinformation. And that might make us more predisposed to, to getting the infection. Lastly, a lot of healthcare personnel in the study that I saw from the UK, I think was citing more healthcare personnel of color being affected by
Yeah.
COVID. And a
Yes.
factor that was raised is that
Mm-hmm.
a lot of these healthcare personnel are immigrants. Now, because they're
Yes.
immigrants, they are likely to be scared to speak up when
Yes.
the protective clothing or
Gears.
whatever it is, PPEs that they
Mm-hmm.
need is not available. The fear that they might
Okay.
lose their job, the
Okay.
insecurity that is there, as being a foreigner, will make them do things that perhaps locals will, blatantly just refuse to do. And
So
there is no.
what you're saying is that one of the main or major factors is, would I say, not, I don't want to say immigration. Should we say immigration, or should you say socioeconomic inequality?
I think it's more of insecurity than anything.
Mhm.
So if you're an immigrant in any country, even if you have the citizenship of that country, there's a part of you that still feels insecure because
That's true.
your citizenship can be withdrawn. You were not born in that
Yes,
country.
that's true.
Yeah, and you fear you might lose your job. You fear you might have to go back to your place of birth, which is not an
Hmm.
option for many people. So
That's right.
just a lot of people would say, you know what, this is the only job I have. It pays my bills. Let me just do this job, and people do it. So we're likely to take more risks and be more scared to speak up and say, no, I can't do this. I don't have an N95 mask. I can't do
Yeah.
this. So if the boss says, hey,
Okay.
you have to do it, and they just do it. So
So
these are
basically,
all.
Black people should speak up more, regardless of your immigration status. And in this period, this particular pandemic period we're in a nutshell, Black people, whether you're an immigrant, if you're an essential worker and you're not comfortable with the sort of maybe rota or position or workload, you should be able to speak up with validity, right? Give a valid, not just being lazy and mucking about, like some people might want to do, take the pick, I don't want to use the word take the piss, but just want to pull, just lazy about, just be valid in your reasons, and hopefully they would understand, as opposed to saying taking everything thrown at you as an essential worker, which is what many immigrants or Black people will do in the frontline profession, right?
Yeah, absolutely. I mean, there's no point being a hero for a sake that is not a worthy sake.
That's
I
right.
mean, every health worker is signed up for moments like this, but if it's the responsibility of the hospital management to provide PPEs to protect staff, if those PPEs are not there, you should speak up and you should let them know that it is their responsibility to do their job when you want to do your job as well. So you can only do your job if you're alive. So it's for the good of the bigger community. If you remain alive, then you can help to save more people. So being scared or cowardly or saying, hey, you know what, I don't want to lose my job, or I'm going to be picked on, I'm going to be bullied later on, all those fears, they might actually be legitimate concerns, but I would rather that one stays alive and deal with those concerns than to be dead. Because a
That's
dead,
correct.
yeah, a living dog, they say, it's better than a dead lion.
That's correct. Now, Dr. Deji, when you mentioned PPE, the protective, personal protective equipment, this is the Western world. Forgive me if I'm a bit naive, but this is the Western world. We're not back in Africa or India or somewhere. We're talking about PPE will come under technology, infrastructure, and all of that. It's unimaginable that such an equipment so vital cannot be produced in the Western world, or they're running short of it. This is some of the conspiracies I've heard out there, that it's a deliberate attempt to reduce the world population, hence why the PPE issue has been flogged over the countries. It's a deliberate attempt by the powers that be to reduce the world population, hence why they're using the PPE as a front in the medical sector. What have you got to say about that?
Well, I don't agree with that. Personally, I don't think it's to anybody's advantage to do that. I think what this has shown is the weakness in globalization. So over the last 15, 20 years, the world has indeed become a global village. So you have supply chains from all over the world. I can tell you for a fact that until we had this COVID-19 crisis, I did not know that the majority of the N95 masks that we use were actually
Yes.
imported into Canada. I did not know that. I actually thought
Wow.
that Canada produced, the majority of the N95 masks, but that isn't the case. So a lot of the, even in the, thriving economies of the world, because of
Mhm.
globalization, a lot of the drugs, the either ingredients used for those drugs or the drugs directly have been outsourced
Yes.
because maybe they're cheaper, or or for whatever reason. So a lot of these
Mhm.
drugs are produced outside of the country. Now, with COVID-19 coming in, people are quarantined, so they can't go to those factories in those countries. So production
Mhm.
has reduced or halted. And even in cases where productions, continued, transportation has been disrupted. So
That's
planes are really not
correct.
flying, things are not moving. So there has been a disruption in the global supply chain. And I think going forward, there's going to be a lot of rethinking all over, the various global economies on how supply chain will be managed. A lot of countries are going to have to really rethink and say, yeah, you know what, even if it's going to be more expensive, we would rather produce these things in our country just for
Emergency,
situations
for
like this,
situations
yeah, in, in
like
in in
this.
future. So I
Absolutely.
think
Absolutely.
that is actually what has led to the inability to quickly ramp up the production of PPEs. And these are not things that you can put together in a month or 3 months, just like that.
Okay, thank you so much again. Now to the most important and pertinent question here for me tonight personally. I was listening to Sky News, which I've run by you already. I was listening to Sky News about earlier this week, and Watford defender, a footballer, Adrian, is it Madras? Adrian, Madras was is a Watford footballer. He said they were asked to come back to their clubs for training just this week on Tuesday. I was just watching Sky TV, and he obviously, as a footballer, you're going to get tested before you start your training to make sure everyone is fit because of the lockdown. And this guy was so upset when his test result came out positive. He was livid. He said, "Hang on, I've done everything in the book. I've been indoors. I've only, walked with my children, taking my children on short walks. I've not been anywhere. I've not entertained anyone. It's just been close family. I've been doing my exercises regularly, been homeschooling my children. So how on earth could I be positive? How could I have tested positive to COVID-19? So again, bear in mind, he's biracial. So I want to understand. People are saying we're not going out. I mean, by the way, I lost a friend's friend, lost her dad about a month ago to the same issue. The father stayed indoors, never went anywhere. He was caught up in the lockdown, didn't go anywhere, didn't entertain anybody because obviously her parents were elderly. They stayed in the house with her mom, her dad, and the immediate family. But the dad was diagnosed of COVID. He's passed on now. So, I'm not trying to disregard anyone who's lost a loved one, but my sympathy goes to anyone who's lost a loved one through to COVID-19. Can you please just give us clarity around why this has happened? People who haven't been in touch with anyone, they've isolated, as we've been told, stayed indoors with their family, their children. How can you test positive when you haven't been in touch with the outside world?
Oh, well, yeah, it's a good question. The transmission of coronaviruses, whether SARS or MERS or COVID-19 as we have right now, is only through contact, either through fomites
Exactly.
or respiratory droplets or stuff like that. So it is practically impossible to have the infection if you have not been in contact with someone who has it. What I suspect is that these people might have been in contact with super spreaders who are asymptomatic, right? So these are people who don't have any symptoms, and they might have been cohabiting with those people, and
Super
they get
spreaders.
they get the infection, but the guy next to them, has the virus, is shedding it, is infecting people. He has no symptoms. Now the guy next to him or her gets the infection, gets really sick, dies. And then they said, "Yeah, but I haven't been anywhere." Yeah, you haven't been anywhere, but the guy living with you is actually positive, even though he has no symptoms. So, and that is the problem that we have with COVID-19. Um, Diseases like other coronaviruses that we've had in the past, like MERS or SARS, when people have them, people become really sick quickly. Within 10 days, they exhibit all the symptoms. So the rest of the people around them are able to, identify them and isolate them and, you know, make sure that they don't go near those people because they are sick. They are really ill. But with COVID-19, it's not the case. So you have lots of people who have the infection. They're able
Yeah.
to spread the disease, and yet
Mhm.
they themselves are not ill. So it's
Mm.
a big tragedy for us. Yeah, and I think that's the challenge going forward. How do you treat
But
an enemy that you can't see?
how can you possibly? I'm trying to work it out in my head. You've been indoors, family, mom, dad, children, grandma, granddad, whoever it is that makes up your family. You're indoors. So what you're saying now, from what I gather, is the possibility of one person in that family already positive is there. And
Yeah,
also, when nobody, even when nobody is actually positive, what you're saying is, in the event that somebody goes out there to do essential buying of stuff, they might come back with it. And
yeah,
because they're not showing symptoms, it is highly likely that they will pass it on to people in their immediate family indoors who have been locked down with them. But then
absolutely.
again, how are we supposed to survive when we have to go and buy stuff in the stores and all that? What do we do? Because it's inevitable then.
See, this is the problem we have. I was listening to one of those viral WhatsApp audio stuff that was posted, and this was about a guy. He was speaking mostly in Yoruba, a little bit of English here and there. The guy sounded really very worried and concerned. But basically, his
Yes.
message was that in Lagos, a friend of his mom or grandma had a fish bone stuck in her throat.
Front.
They went to a hospital in Lagos, and they just wanted the fish bone removed. And when they got there, that the doctors decided to test her for COVID, and found out that she was positive, and they said they were going to isolate her. And
Wow.
she said, "No, but this woman only came for this fish bone that is stuck in my throat, in her throat, and that the whole COVID thing is a scam. That they were giving the health workers 25,000 naira, and that they would identify people." And when I saw that, um, I laughed. It's not a good laugh, right? I laughed because the guy is obviously talking from the sincerity of his heart, but he's sincerely just not well educated. So coronaviruses, and it's been the same experience with MERS and SARS, and with COVID-19 too. For example, that the elderly people have presented atypically. It's not unusual. And it was one of the reasons why the disease that spread so quickly in New York, for example. A lot of the elderly patients came in with things like this, fish bone stuck in the throat, fractures, eye pain, whatever it is. They were admitted to hospital, but they were not
Mhm.
screened for COVID. And the nurses kept
Right.
moving from them to other people and spread that, COVID infection. And before you know it, the whole hospital complex is now loaded with people with COVID-19, and a lot of people were dying. So when you see in this guy's experience, he thinks that the fact that the mom had, or the grandma had a fish bone stuck in the throat means that the grandma does not have COVID. In fact, as a matter of fact, I would have done exactly that if I was practicing in Nigeria. If I see an elderly person who presents to the hospital, and I
Yes.
think this person is probably fish was stuck in the throat because mama's ability to respond, has been, diminished.
Diminished.
I would
Yes.
swap. I would swap the woman, which is what the doctor in Lagos did. And the woman came from. Long story short, they put up a fight, and mama and her son escaped from the hospital.
Oh my
Now
Lord.
the sad part of this is that the mama is going to go home now. Yeah, it might be
And
mama's grandchild
infect.
who will now get exactly and might die. But that's a different story entirely. The COVID in sub-Saharan Africa and what we're doing is a completely different story. So my proposition is that the footballer was definitely in
Yes.
contact with someone. You
But
you
he's been
you there's
indoors. He's been
yeah,
indoors. Maybe
so
his wife had gone shopping, come
that's
back
what
with
I'm
the
saying. It might not be
essentials,
him.
or
Yeah, it might
maybe,
not be
but
him.
a lot,
It,
a lot
it
of
might have
people
even
do
gone,
grocery deliveries,
yeah,
online
but even
shopping.
yes, but it might have even gone out on a stroll and walk past someone
Wow.
who stops and talks to him at a close range, or just greeted somebody or somebody at a close range. If the distance is close enough for the person's saliva to hit him when they talk, he can get the transmission, even with the grocery stuff. If the guy
Online
handling the
shopping.
plastic bag, yeah, this still has to be delivered by someone.
Yes.
Yes, and it was packed by someone.
Yes.
And while, these are all conspiracy theories, I don't know, I wasn't there when his stuff was packed. But if you have someone who is a super spreader, who is not taking precautions that should be taken at the store, I doubt that is the case. Yeah, we're just thinking wildly. There's a possibility
Okay.
that, those things could bring in fomites
In
or,
contact.
so we don't know. But one thing I know for a fact is that he was in contact with someone who had the virus. Whether directly
Okay.
or indirectly, it's arguable.
Yeah. Oh, that's fine. Obviously, it's arguable. Now, which brings me to the next question, which you mentioned, asymptomatic, right? I've been wanting to for that. It's just general across the board. And what does being asymptomatic? What is the scope of being asymptomatic?
Sorry, the line went up there
Oh
a little
dear.
bit. Can you repeat?
Yes. Oh yes, we lost connection there because the weather's very windy in the United Kingdom, so there's a lot of wind blowing. I said being asymptomatic, which is what you mentioned in regards to these people that may have actually in contact with others and not realizing it. What does it mean to be asymptomatic? And just briefly give us the scope, how far this being asymptomatic with COVID can actually go and the damages it can cause.
Well, yeah. Personally, in my opinion, I think this is the problem that we have with this particular pandemic, and
Yes.
it's a problem that I don't even see how we're gonna go around it. So the virus also is an organism, and the virus, um, like any organism, does not want to die. So,
COVID-19 is not done.
can you hear me? I think the signal went off again. Can you hear me?
Yes, it is. Yes. Can you hear
Okay.
me?
So basically, what's going on now? Yes, we're back. So
it's really terrible.
yeah. So what's basically going on is that we have people who have the virus, but they are presenting with no symptoms at all. So they're able to go out. So it's either they have no symptoms at all or very minimal symptoms. But they're able to go
Right.
around, go to the beach, go to the
Yeah.
stores, mix, go to parties, whatever.
I've been going to the store. I've
While
been going to the store to do my essential shopping. I've got children. I've got to go to the store, get them toiletries, get food in the house. What can I do? So, I mean, am I asymptomatic?
no, it's actually you're doing nothing wrong. There has been no recommendations that people should not go to the store. I think one of the studies I read up on a few days ago was talking more about even though we believe that COVID can be spread by through droplets.
Yes.
It's also about the length of time that you spend in this space. So if you were to go to a Walmart, for example, and do your shopping, I don't think you are so much at risk if you put on a mask to protect others. You wear, wash your hands or sanitize your hands because you're going to do your shopping and come out. So your risk is there, but it's low. But I'll be more worried about the guy who has to stay there for 8 hours.
Right. Who's the shop attendant, the store attendant?
Yeah. So for that guy, yeah, the risk is higher. So yeah. So these are the issues. There's still a lot of things that we don't know about COVID-19. Honestly speaking, there's a lot of things we don't know about coronaviruses. Um, the SARS, which was I think 2003 thereabout. The MERS, which was 2012. These are
Yes.
coronaviruses. Until today, we still don't know a lot about them.
So SARS,
So
MERS,
Yes, we no,
influenza?
influenza is a different type of virus, but those
Okay.
two are recent. We
Oh,
have lots of coronaviruses, like lots of them. They mostly exist in animals,
right.
right? Yeah, so we have lots of them in cats, in bats, in stuff like that, and really we have cross transmission between between
Humans.
animals and humans, right? Exactly. So
What makes
this
this
cross
one
trans
different? What makes this particular coronavirus? If we've always had coronavirus forever and ever, it's always been there in existence. Why is this particular, is it strain? Is it pathogen? I don't know what to call it, but why is this particular coronavirus so different, deadlier? What makes it special if we've always had
Okay, so
coronaviruses?
this is the way I like to describe it. So let's imagine it's a war between two organisms, right? The human
Yeah.
race or the human being is an organism. The virus is an
Yes.
organism too, and we both have rights to this planet, right? So it's not like
Wow.
they exist on this planet. They don't. The virus does not want to die, just like
So
the
it's like Game
human
of
being.
Thrones. So it's like Game of Thrones
Yeah,
now.
so the human being does not want to die. The virus does not want to die. So
Wow.
each one is strategizing. So this is a very basic, it might not even be the best scientific way of describing what's going on, but I think you'll get the message. So there are two
Okay.
organisms at war. So you have the human and the coronavirus. The human does not want to die, so the human is inventing what do you call it, hand sanitizers,
Sanitizers.
washing
Yeah.
hands, quarantining, and all of that. The virus is also trying not to die. So the virus is
Wow.
also doing stuff. The difference between SARS and MERS will be, if this was warfare, then you would have SARS and MERS, both coronaviruses. They don't have camouflages. They have maybe a big stick or a pistol, a pistol, or some kind of old war equipment, and they're coming to fight you in broad daylight, right? No camouflage. They're running towards you. So you, as the opponent, as the human, you can pick them out and shoot them down because you have more sophisticated equipment or weaponry, right?
Your
Now,
Lemsip, your ibuprofen, your whatever you use for MERS, SARS, and all
even,
that.
all those, even with MERS and SARS, there was no treatment. We never came up with treatment. We never came up with vaccine till
And
today.
they are coronaviruses as well.
Yes,
A
those are
family of
coronaviruses. Yes,
coronaviruses.
exactly. So back then, I think 2012, we're calling MERS, the Middle Eastern Respiratory Syndrome coronavirus. We're calling it the novel COVID at that time.
Yes.
We're still calling this guy the novel COVID. But this is COVID-19 because it
Yes.
was discovered in 2019. But it's not the first COVID. So
Right.
what I'm trying to say basically is that this guy, this COVID, because of the ability to infect people, and the people will have no symptoms or minimal symptoms, is able to cause more damage. So if you were in 2012
Interesting.
and you were in Jordan or Saudi Arabia, and there you had MERS, a person with MERS is typically very ill.
Right.
Top 10 days, the person shows respiratory symptoms, shows, organ failure, stuff like that. The person is ill. Once the person is ill, that is to the disadvantage of the virus. Because the moment the person is ill, the family around that person isolate
Is
him
at
or
risk.
her, right? And because they know you're very ill, you're running a temperature of 40 degrees
Hmm.
centigrade, you're so ill. So they
Yes.
isolate him or her and they take
Right.
precautions,
Hmm.
right? And
Yes.
there are way higher mortality rates with them. So the person has the
Right.
virus, is very sick, cannot even go around, can't go to the streets, can't go to the beaches or clubs or anything. So can't spread it. But with COVID-19,
Okay.
there are people who have the virus who have no symptoms. So they're able to go to the beach, go to clubs, spread it, go back home. And the people they give it to can become really ill and die.
Hmm.
So if you
Okay.
do the math, you have
Asymptomatic. if you're asymptomatic, you're a super spreader, like you say. You're spreading and
Yeah.
spreading and spreading unknowingly, unknowingly. But my question is, how long would would an asymptomatic person carry that ability to spread? Would they ever get knocked down by this virus? Would they ever fall ill themselves?
No, no, no.
Or would they just be as a carrier for this virus?
So what happens with viruses is that if you have a cold, like a rhinovirus, and some coronaviruses come as common colds too, right? That we get.
Wow.
Some strains of coronaviruses we get as
Mm.
common colds. You'll be down with a little bit of fever, sore throat, cough, but within 3-4 days, you're back on your feet and you're running around. So what typically happens is we have the coronavirus, your body develops or responds to that virus. There's an immune response to that virus,
Okay.
to fight that virus. So your body, there's going to be this, back and forth shooting. Let's imagine it's a war, right? So you're going to throw your bomb, they'll throw their bomb, you shoot, the virus shoots back. But the virus, compared to your immune system, if it's strong, it's disadvantaged. So it will stay for a while, but invariably your body will overpower it and conquer it. So you won't have that common cold forever, right? But while you have that common cold, you can give it to your colleague at work. So did you get that? I know
Yes.
So what I would say basically is, okay. So what I was saying is that if you have a common cold, for example, it takes about a week or maybe 3-4 days for your body to develop an immune system response to overcome that common cold. And you will invariably pull off that, be able to mount enough immune response to defeat that virus. So the common cold will go. But while you had that common cold, it might be a coronavirus, another strain of coronavirus. While you had it, your employer will say, don't come to work, right?
Yes.
The reason they don't want you to come to work is while you have that infection, while your body is still fighting it, you can transmit that infection to someone else. And it starts a new course in that person. But by day 5, you're good. You're probably back to work. Now, your colleague is starting his or her own day 1 with the virus. So it's the same thing with the super spreaders. Their body is going to mount an immune response. The immune system is good. The chances are that they will fight that virus. They'll be fine.
So they will kill it off. Their body will naturally kill it off eventually.
Yes, exactly.
And while they're busy spreading out, so while they're busy spreading, and that's probably when their body is still working out which bomb to shoot to kill the virus which is already in them. So their body is doing what it's doing. In that time,
they have the upper hand.
That means
they have the upper hand. That's why they're not sick, right? They have the upper hand.
Yes.
So imagine you have this world superpower taking on this very tiny, poor country. So that country, that world superpower, can be at war, and the country might not even feel it at all because they're fighting a country that is comparatively, really nothing. So that's why they call the body is mounting an immune response. They're fighting a war, but they have so much advantage that they're not even bothered by it.
Okay, fantastic. Wow, this is also it's crazy. These are just viruses we're talking about. How can a virus be so clever? How can a virus be so calculating, clever?
Yeah. So it's not. No, Ada, it's not the first time we've seen viruses behave like this. So let us look at the HIV virus, for example. It's even the HIV virus is even smarter than the coronavirus. And if I may add, till today, we still don't have a cure for HIV virus, but we have a treatment right now. But we still don't have a cure. And I don't think we have a vaccine that can prevent, that is effective. So if you look at the way the HIV virus works, for example, what does it do? So the HIV, it's mostly transmitted through sex, which humans love to do. We are the sex
Super
maniacs of the
spreaders.
planet. Yeah, as humans, there is no animal or organism in the world that has the as much sex as humans do. So
Wow.
the HIV virus is transmitted through sexual intercourse mostly. Like it can be through blood and all of that, but most of the infections are transmitted through sex. So
Sexual.
it's a very strategic, very good way of spreading the disease. So if you are HIV virus, you've chosen a good way of merchandising your product, because this
Wow.
Homo sapiens cannot do without having sex. So the virus gets into the body, right? What does it do? So you have the immune system, like your soldiers, right? In the body, they are
Yes.
called CD4. They're called CD4 cells. So you have CD4 cells, you have CD8 cells. These are like your Navy SEALs or your commandos, right? Or your special forces. These are the ones
Yeah.
that are currently now fighting the coronavirus, or fighting whatever virus comes into the human body.
One's
But what
body.
does the
Yeah.
HIV virus do? Right? It goes into the body, then
Yeah.
it camouflages itself and pretends to be a Navy SEAL. So instead
What?
of identifying itself as an enemy that the body can pick up and fight, it drops its gun, drops
It's ammunitions.
its bomb, it drops everything. Rather, it learns, if you speak, let's say you speak Turk or you speak Ibibio or whatever language you speak. So the HIV virus learns that language, puts on your
What?
attire, right? And then moves close to you, the commando, and says, hey, greets you in the native language. And say, hey, you're mistaken. I'm not the enemy. I'm a friend. And in fact, I'm stranded. I have nowhere to sleep tonight. So the CD4 cell is tricked. So CD4 cell that is supposed to fight this virus now says, oh, so sorry. Don't worry. You can come and stay over in my house for the night. So the CD4 cell attaches itself, the virus, the HIV virus now attaches itself to the CD4 cell. Then it gets into that CD4 cell, gets into it. Now remember, the CD4 cell is not mounting any response. Once it
No.
gets into the CD4 cell, overnight, it murders all the occupants of the cell when they are sleeping.
Wow.
Then it starts reproducing itself
At a
in that
quick rate.
house. Right?
Wow.
So now other CD4 cells won't attack that CD4 cells because the door is locked. They think it's a CD4 cell. But inside that CD4 cell, there was one virus that entered. By the time that CD4 cell busts open, there are like, let's say, 10 million new HIV viruses.
In the body.
Yes, in the body. And then each of those 10 million quickly learns the language of the next CD4 cell and drops their gun and their weapon and say, hey, I'm not here to attack you. There's no need for you
And they
to fight me. I'm a
multiply.
friend.
And they
And they keep
multiply.
multiplying. Yes.
And they
But the
invade
body,
the entire body.
yeah, but the body keeps mounting a response. It sees that there's something wrong, but can't figure out how to fight this guy because it's using the CD4 cell that you're supposed to use to fight to actually reproduce. So
Wow.
at a point, the body gives
This
up.
is heavy.
The body gives up and not able to mount up an immune response. And when the body is not able to mount up an immune response, then things that ordinarily, will come and your body will fight now pose a serious problem. So people with HIV at that point, we say they're in stage 3, stage 4. Stage 4, we call it AIDS. And then simple things like diseases that affect birds, that don't affect humans, then they come down with those diseases. These are diseases that we breathe in every day and our body will fight them off. But now they come down with those kind of diseases, things that shouldn't cause diarrhea.
Wow.
So it's not the first time that you've seen viruses behave in a smart way, right? So
Wow.
I just
So
use that example.
we have a lot to be afraid of, really. Then we have a lot as human beings all over the world, not just blacks
It,
now, or Asians or
exactly,
whites.
exactly.
There
So
we have a very valid reason to fear, not fear as such, but
no,
to
actually,
be
the word is
aware of
fair.
how
No,
deadly.
no, no. See, we are not politicians, and I understand that. Politicians need to, pad their words in a way that people have hope, and and yeah, we do have hope. I'm not saying that this is a hopeless situation, but we do have a lot to fear as a race, as a species. We are where we are with the virus, where we were with bacteria prior to Second World War. If you might believe it or not, just before 1942-43, there was no antibiotic available in the pharmacy
For
to
bacteria.
treat things like pneumonia and cholera and tuberculosis, and people were dying because of typhoid and things today that you would take a course of a 5-day course of antibiotics and be fine. Prior to 1943, people were dying from those things because we had not yet developed antibiotics. At the
Which
moment, we
brings
do have
me, which which brings me, Dr. Deji, before we digress to antibiotics now, to the next issue about compare, I mean, obviously, with everything you said now, in comparison to the UK, to Canada, to USA, because you're based in Canada. I've got Dr. Deji Daramola with me. For those of you who are just watching or joining in, he's a medical physician, medical practitioner based in Alberta, Canada. He runs or owns his own medical practice. And we're talking about the topic, as you can see, it's pinned on there, Black and ethnic minority people who are dying in the UK and across the world, and what it means to be asymptomatic with COVID-19. And we've talked about the footballer Adrian Madrapas, I can never say his name right, Madras, Adrian, Watford defender. And we've talked about how asymptomatic people can spread this. What I want to touch on now is in the UK, there's this deliberation whether children should go back to school or not. That's on one issue. And we know that children are like super spreaders. Quickly, in maybe 2 sentences, do you think it's wise to let children return back to school as early as June?
I don't know. That's the honest truth. I don't know. There are still many things that we don't know about the virus. I think in the last 4 weeks or so, there were some studies that just showed that children, had their own atypical presentation with COVID-19, and
Yes.
some actually have died. But I can
Yes.
tell you, 2 months ago, there were a lot of us who were actually saying that the virus does not affect children, at least that they were super spreaders and they can't get ill. So the science is evolving. The knowledge is increasing. A lot of the earlier studies were done, the very first studies were done in Wuhan, in China, and the subjects were people who are very ill. Now we are able to do studies on people who are not so ill, and the results are not exactly always the same. So things are changing, new information is coming up every day. The virus itself is mutating, trying to
It
adapt.
keeps it
Um,
keeps changing its format. It
yes,
forms.
keep evolving, yeah, for survival. Now, whether the rate of mutation or evolution is such that it's affecting how we respond to it is what we don't even know yet. There are many scientists who believe that the rate of mutation is really not significant enough to affect the way we respond to it at the moment. Others disagree. So we don't know. That would be for policymakers,
All
right?
right, let me
But
just say this, Dr. Deji. We're not okay. We don't know so much about COVID-19 because the virus keeps changing. Today it comes with this strain. Tomorrow it shows this symptom. Next tomorrow it shows something different in each person, right? Each person displays COVID-19 in their bodies differently, and you don't know what exactly it is. So now, based on that, would you say, because I was reading Bloomberg News update some days ago, as I mentioned to you earlier, they were talking about a second wave of COVID-19, the likelihood of a second wave. I hope it's not true. I hope I misread this. In your experience and in your, your medical practice, is it likely that there might be a second wave, or have you started seeing a second wave already?
Yeah, there are second waves already, and there will be third waves. I'm convinced about
What?
that. Yeah. So
There'll
it
be
depends
second
on
and
where
third
you.
waves.
Yeah, that's my personal opinion. Definitely, we're seeing second waves in Asia, right? Southeast Asia. Um,
But
there
what does that
the
mean? Sorry, Dr. Deji.
so
What does that mean? Second wave. Please
so
explain. Does that mean fresh
it,
people, new set of
so
people are
you're gonna
getting
have
corona
you're
now?
gonna have a fresh spike.
A fresh type of corona,
No,
another type of corona.
a fresh
Is that,
spike.
are you for real?
Yeah. So let's look at what we have available in news. So this started in Wuhan, right, in China. So they had
Yeah.
the advantage of uh, having a
Being
head
able
start.
to do the research and
A
see
head
what's going to
start.
happen. But in
Yes,
the
they had.
second wave, would that be possible or not?
Can you come again with the question? I didn't get it.
With the second wave, would they have the opportunity? I mean, we're expecting a second wave. What does that mean? Does that mean we've got about what? We've got about 8 minutes to go for this interview to round off. What does second wave mean? Does that mean new symptoms are going to come or new coronavirus is going to appear? What does it mean by second wave?
Okay, so second wave basically means that you're going to have another bout of infections. It's the same coronavirus, but at the moment you can say that, okay, maybe 10 people are infected for, theoretical purposes. Let's say 10 people are infected. We've been able to treat all of them. We discharged 9 people, 1 person died. At the moment, maybe we have 0 infection or we have or 1. When you say you're having a second wave, it means you're going to have another spike in the number of people that are infected, and then you're going to start all over again. So there
So the
might be
graph, the
shutdowns
graph is going to
again.
go up. It's going to go
It's
up.
going to go
So a
exactly.
flattened
So you might
graph
have a second,
go up.
yes. Basically, that's what the second will be. So you might need to shut down again. You might need to send the children out of school or close down the schools. You might need to, shop barbers,
Do the whole
shops.
lockdown
Yeah,
again.
you might need to. Yeah, exactly. You might need to do that all over again.
So
But
it's wise
that's what I'm
then.
saying. That
So it will
yeah,
be
no,
wise
it
for the
is.
economies and countries to start looking for other ways to still function without physically being there, i.e., going to work, selling things. There has to be. We should start thinking of innovative
Yeah,
ways to do things.
that is actually not that we're gonna start looking for. That is already happening, and that is the way of the future.
So
So
that's
we
the
are
way. That's
never
the new normal
ever.
now. That's going to
Yes,
be
we
the
are
new
just
normal.
like wearing mask is now acceptable. If you were to wear mask in this part of the world, this time last year, people would look at you really weird. Like, what's wrong with this guy?
Was
Well, now
We
it's
were looking at
acceptable.
Michael Jackson weirdly. We looked at Michael Jackson weirdly when he was doing that, but that was for a different reason at that time. Very quickly,
Yeah.
Dr. Daramola, just before we round off, wearing masks, is it really helpful? Because I've heard all sorts. The viruses are so tiny, they can pass through the fabric of the mask if it's cloth. So is it really helpful?
Well, it's largely helpful for you not to infect the other guy if you were
So
to have
if
the
you're
infection.
already, yeah, so for someone who's already contracted coronavirus, the mask helps
And
them
you,
not to pass it on. But for a person who hasn't contracted it, is the
for
mask still
someone who
helpful?
hasn't, not really. It's better than nothing, but it's not going to, really stop it. So for you to
Okay,
have a mask that will filter out the virus, you'll be talking of a medical grade mask like an N95 mask.
okay,
Right?
okay.
And
Yeah.
that is scarce. But two
And
things
and
that you
that's
need to keep
plastic.
in mind. No, it's not
Yes.
plastic. It's just more. It has more filters in it. Two
Okay,
things
it
you
has
need to
more
keep in
filters
mind
in
is the distance, right? So
it.
if
Okay.
you have a mask, yeah, if you have a mask, you're less likely to spit on people when you talk, and these things
someone
happen. We just don't
directly.
notice. Yeah, we don't
The
notice them
droplet,
when the
yes,
droplets.
because
Yes.
they're
So
so tiny.
if we all wear masks, the society is going to be safer.
Okay, okay, fantastic for that. Lastly, Dr. Deji, can you just tell us, is there going to be a vaccine or not? Will there be a vaccine or not?
In
Or
my
just
opinion,
treatments? Yes.
me projecting, I don't think so. Um,
Wow.
I think that the response we're getting right now from the government all over the world is, I mean, there are efforts being made.